Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner, Precinct 1.
Present.
Andy H. Wynn, Commissioner, Precinct 2.
Here.
Gary Fickus, Commissioner, Precinct 3. J.D. Johnson, Commissioner, Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation this morning will be delivered by Pastor Darwin Jordan from the First Fort Worth Presbyterian Church. Thank you very much for coming out today. After the invocation, please remain standing for our pledges.
Let us pray. Oh, Lord God, we praise you that you made us in your image. And so, unlike all the other creatures on this earth, we actually can have fellowship with you. We can know you and commune with you, adore you and enjoy you throughout our whole lives and throughout eternity if we trust you, Lord. We thank you also that being made in your image, we can reflect your wisdom, your goodness, your righteousness, and your justice. We thank you that in your image we can live these character traits out in our lives and we can apply them in our society. And so we pray, Lord, for this body that they will live out and apply these character traits, that your justice and righteousness and goodness and wisdom will be reflected in everything that they do today. We trust you, Lord, for your grace to do this, and I pray this in the name of Jesus. Amen.
Amen. I pledge allegiance to the flag of the United States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Mr. Manius, agenda announcements.
Thank you, Your Honor. Members of the Court, we do not have any announcements as it relates to the agenda specifically this morning. Just want to advise the Court that at 2 o'clock this afternoon in the Family Law Center, we have the IT Steering Committee. Thank you.
Thank you. Court members, you have before you the minutes of our regular meeting of October the 9th.
So move.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. I would like to ask today that we close our court in memory of Dario Lorenzetti. He was with the U.S. State Department employee and a Nolan Catholic High School graduate. He died on Saturday in a suicide bombing in Afghanistan. Lorenzetti was 42, had worked for the State Department since 2005. He was married and lived in Houston with his wife, Kristen, and their 3 young daughters. He was one of 6 people who died in the Kandahar province when a Taliban suicide bomber rode a motorbike into an intelligence office. Lorenzetti attended St. Andrew's Catholic School. He was an Eagle Scout. At Nolan, he was class president and graduated in 1988. He attended Texas A&M for a year and then transferred to the U.S. Military Academy, graduating with honors from West Point in 1993. He served in the U.S. Army. He trained cadets at A&M, retired as a captain, and then joined the State Department in 2005. His friends said that he was drawn to public service after scouting and his work in the military. He was scheduled to arrive home on December the 15th. Services are tentatively scheduled for this Saturday at St. Patrick Cathedral in downtown Fort Worth, and the details of those services are pending. Great young man, and if we can close our court, and if that's all right with everyone, close the court.
Entirely appropriate.
Court members, you have before you our consent agenda.
Move approval.
Second.
We have a motion and a second to approve the consent agenda. Please vote. Motion passes unanimously. Mr. Manius.
Thank you, Your Honor. Members of the Court, we have 3 additional items to bring to you this morning. First, we're requesting that the Commissioners Court approve a contract for services between Tarrant County and the Tarrant County Juvenile Board which authorizes the county to perform certain purchasing functions for the juvenile board.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Members of the Court, if we could go to item number 2, we're requesting that the Commissioners' Court approve action which would notify individuals and companies who are currently located in room B65 of the historic courthouse to vacate that location by January 1, 2013.
Move approval.
Second.
By January 1?
I think you said.
I'm sorry, March 1.
Yeah.
Yes, sir.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you, Commissioner. I was too fast on that. Members of the Court, if we could go to item number 3, we're requesting that the Commissioners' Court review and approve an exception to the county's travel policy as it relates to the 325th District Court. This concerns Judge Sudworth. She attended the American Judges Association annual conference on September 29th in New Orleans.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote.
And dead?
Yes. Judge Sudworth had not been traveling out of state for several years now, and she simply forgot to request prior approval on this trip. So this is an exception to the travel policy where we're asking you to approve this reimbursement.
Any other discussion? Please vote. Motion passes unanimously.
Thank you, Your Honor.
Thank you.
Move to receive and file personnel agenda.
Second.
We have a motion and a second to receive and file personnel agenda. Please vote. Motion passes unanimously.
Thank you and good morning. We have 2 additional items for the court. We're asking the court to approve the extension of project employment in the district clerk's office. The district clerk is requesting the extension of a project employee assigned to the scanning project through November of next year. There is no impact to the general fund.
That'd be 5 again.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our third and final item, we're asking the court to approve a waiver of terminal benefits for the county auditor's office. The first assistant county auditor is going to be retiring from county service in December. The county auditor is requesting a waiver effective December 8th, and we're estimating that the impact to the general fund will be a little bit more than $25,000.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Ms. Brewer?
Good morning.
Good morning.
We have one item for your approval today, and that's the reappointment of our Deputy First Assistant Health Authority. That's Dr. Catherine Colquitt, Kate to us. She's hard at work back in the clinic this morning. This will be her 3rd term.
Move approval. Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Mr. Beecham?
Oy vey, Mr. Beecham.
Sir,
Oy vey.
good morning.
Good morning.
We have 3 items for your consideration this morning. 49-7.
He's not paying attention.
49-7.
He's still not paying attention. Go right ahead, Mr.
Our first item is a bid order recommendation for RFP 2012.
Football?
Sir?
Kentucky football?
Yes, sir.
Arkansas?
They called it that.
Oh, I'm not paying attention to Kentucky football. Wait until basketball season.
You better hope it gets here in a hurry.
See how
RFP
easy it is to ignore a guy from Arkansas?
2012-142 for a life skills program for juvenile services. Recommendation be toward the Santa Fe Youth Services in the amount of $78,400. Also seeking contract approval from the court.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our second item is also a bid award recommendation for RFP 2012-164, annual contract for electronic medical record system support for the health department. Recommendation be awarded to Clear Health Incorporated, the amount of $42,966. Again, we're seeking contract approval from the court.
Move approval.
We have a motion and a second. Let me ask just one question. This, our medical or electronic medical records, is that something that is eventually or already will communicate with other groups around the other hospital systems, our JPS and so forth?
Yes. I don't know if JD wants to say more in particular, but it does speak the common language, which is HL7, which means, as we all get better at, once we all get our own internal systems up and going and running as smoothly as we would like, then we'll all be looking at health information exchange, and that means how do we share information as appropriate and with permissions from the individuals, so that if you show up at another hospital emergency department or in one of our clinics, then we'll be able to benefit from having the information from previous visits.
Since a lot of, or at least some of what public health does is vaccinations, what about linking with other providers, i.e. the doctor's offices themselves, and having that ability to tap into theirs or they into ours?
Well, it's an excellent question. We already have an immunization registry, and we're working on getting that updated so that it will be able to do that very specifically. And that is one of the top 3 issues with health information exchange, is that you'd be able to do just what you described.
And Your Honor, on that one there, we've been doing that for the last 15 years on our exchange, and we have the vast majority of pediatricians in hospitals already connected to that system.
Any other questions? Please vote. Motion passes unanimously. Thank you.
And our last item is also a bid award recommendation for our bid 2013-004, the same contract for Type 1 Portland Cement. Recommendation will be toward the Ash Grove, Texas, on a per unit price basis.
Move approval.
Second. We have a motion and a second. Any discussion?
We're no longer involved in a lawsuit with that company, are we?
No, sir.
Thank you.
Any other questions? Please vote. Motion passes unanimously.
Thank you.
Come on down, Mr. Skinner.
Good morning, members of the court. We have 3 items for your consideration this morning. The first item, we are requesting your approval of an interlocal agreement with the City of Colleyville related to improvements to the intersection of John McCain Road and Pleasant Run Road. This project is included in the 2006 Transportation Bond Program.
I move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
For our second item, we are requesting your approval of an interlocal agreement with the City of Colleyville related to improvements to the intersection of Jackson Road and Cheeksburger Road. This project is also included in the 2006 Transportation Bond Program.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
And finally, we are requesting the court's approval of the renewal of interlocal agreements with the cities of Euless, Grand Prairie, Kennedale, Mansfield, and Saginaw related to projects that are included in the 2006 Transportation Bond Program.
Move approval.
Second.
We have a motion and a second. Any other discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Commissioner Fickus, I believe you have an interlocal agreement.
I do. This is a memorandum of understanding between the City of Southlake, Gateway Church, Cooper and Stebbins, and Tarrant County, along with TxDOT, to build I guess you would call it a U-turn turnaround on Highway 114, just southeast of the Carroll Road intersection. And it's our part is is $250,000, which is coming from discretionary funds.
Second.
A motion, a second. Any additional discussion? Please vote. Motion passes unanimously. Commissioner Johnson.
Have an interlocal agreement with the City of Fort Worth for the reconstruct asphalt overlay of Casa Manana parking lot. Move for its approval. Second.
A motion, a second. Please vote. Motion passes unanimously. Appointments?
I have a reappointment
Okay.
of Richard Sally, P.E., to the board of the Northern Trinity Groundwater Conservation District Board. Move for approval.
Second.
A motion, a second. Please vote. Motion passes unanimously. And I would like to move to appoint Commissioner Wynn to the PEBC Board to replace Commissioner Brooks.
I'll second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously. You have before you the claims, including the addendum.
Move approval of the claims, including the addendum. Second.
We have a motion, a second, to approve the claims, including the addendum. Please vote. Motion passes unanimously. Briefing items, Mr. Maines.
Thank you, Your Honor. Members of the court, we have 3 items that we would like to bring to you this morning. The first is the update from the hospital district. This will include both a monthly update and also a presentation concerning the 1115 waiver. Mr. Irvin.
Thank you, Mr. Maines. Judge, Commissioners, wanted to come to you morning, or afternoon, or still morning. Wanted to, you look wanted to come to you today to update you on a couple things. One is, you know that all hospitals are reviewed by the Joint Commission. The Joint Commission makes sure that your quality standards, your safety standards are what they are. You are on a 3-year cycle, and they come every 3 years. We had our inspection of the Joint Commission in April. I mentioned it to you all, gave you all an update on that. We did very well. 2 weeks ago, in fact, right after the Arlington Chamber of Commerce banquet, got a phone call that the Joint Commission had unannounced showed up to our emergency department for a unannounced inspection. Those generally would be the same feeling you might have waking up Monday morning and having 4 IRS officers at your door saying, we'd just like to spend a week with you. I'm sure that it would all be fine, but it would put a pit in your stomach to begin with. So when you get that phone call, you drive as quickly as you can from Arlington back to your hospital to make sure. That inspector spent some quality time with us from 9:30 at night until 2 o'clock in the morning and walked through and looked at everything, including the flip-out panels for computers and making sure that the size was the right size for a flip-out and making sure our exit signs were pointed in the right directions and everything was the way that it should be. And I'm proud to tell you as commissioners and judge that watch over what we do and help us in our way, he had glowing remarks about what we did and how we did it, and I was incredibly impressed. And Mr. Whitman and I and Wanda Peoples, our CNO, personally walked by and thanked every one of our staff that was on that night. That's a proud team, and I'm not always going to get up and brag. If they came back with a negative report, I would have told you about that. But for that inspector to tell us that it was the cleanest emergency room he's seen in his inspections and make some of the comments he made were very pleasing to us and to you as commissioners. Those unannounced visits validate what we're doing, and I appreciate that, so I wanted to let you all know.
Congratulations.
Thank you. I'm proud of the team. Bill Whitman and Wanda Peoples and all of our nurses and our physicians and our emergency room staff. They're good folks. They do a lot of good work every day, every night. And if you're, we had a new employee come to our emergency room. I met her at employee orientation, and I told her the only thing you'll never say is you will never comment, gee, on board, what do we do now? That's not part of the emergency room at JPS, but it's a good place. And
now, it is still the only level 1 trauma center in the county. Is that?
It is the only level 1 trauma center in the county, and we're proud of that, and we do a great job. And I'm proud for that. That elevates not only what we do, but who we bring in and how we do it, coupled with our emergency room residency program, which is really doing well. We're in our 2nd year of that. Great recruits, good program. What I wanted to do is, as you well know, because I updated you and we update the board and we update the community on the 1115 waiver, The 1115 waiver is a way that Texas can be a managed care state and make sure that we're making cost efficiencies with health care, and at the same time continue to receive some federal dollars to offset some of the cost of health care. The work that Commissioner Brooks does in Washington with the commissions that he's on has an insight to this, and he's been hugely helpful to us. Commissioner Johnson, in his role as liaison, we try to keep them involved in this. But I will tell you, I got to give thanks to David Salisbury, who's here today as our Chief Financial Officer. David inherited an 1115 waiver. We all inherited it. The amount of work that he does, the amount of trips now to Austin, his finance staff has totally turned into dealing what the state requires. And no disrespect to the state, and I mean this in no bad way, but occasionally, just on occasion, they will issue a guideline in 1 month, and then they might want to change it the following month. So we have to be very nimble about what we do. So we generally tend to have a lot more meetings because the structure changes. And so David does a great job with his team. But I want to give public thanks to David Salisbury because as a CFO, you don't expect your plate to get 80% greater with an already full plate of things to do. And that's what he's done, and he's done a great job at doing that. We will try very hard to keep you up to date with this, but as I've told Mr. Manius on numerous occasions, it's a constant fluid structure, and even though the fluid structure is there, it's not definitive. But there are two funds, basically, out of the 1115 waiver. The first fund is what we call uncompensated care. And what uncompensated care is it is a program by which you provide federal funds to help offset that money that you're oftentimes shortchanged on receiving charity care and taking care of those bad debt issues. The second fund is what we want to talk about today very briefly, is the Delivery System Reform Incentive Payment. We call that DSRIP for short, because you have to give acronyms to everything you do when you're government related. So we have a DSRIP, and what the DSRIP is designed to do is to do programs to totally transform healthcare and make it a significantly different world than what we've seen, and creates collaborative spirit between a healthcare region. We happen to be in this region, Region 10, which includes, let me make sure I've got them, it includes 9 counties. It includes to a moon shape around Tarrant County, basically, and it goes from Ellis to Navarro. Then you have Hood, Johnson, Parker, Erath, Somerville, Wise, and, of course, Tarrant County. We have worked with those county judges, commissioners, MHMR facilities, and others throughout those regions, and of course, including the private hospitals. And what we have before you is the projects. These projects are designed to look at transforming healthcare. What we will do with these is we, as the anchor institution, JPS is the anchor, we collect these projects. We work with these groups. We meet with them, we meet with the private hospitals, we meet with all the others, and we try to help them design projects that can transform healthcare. We will then submit these programs and proposals to the state. The state will review them and send them up to CMS. CMS will review, and CMS will decide what they will allow to be on the list. So this is by no means a definitive list, and JPS is not in the position of saying you're in, you're out kind of approach. We just say, here are the guidelines you need to meet. We've gotten over 101 projects that we will be submitting. What the state accepts and what the feds accept is their call. Once they accept those projects, then those projects have to meet certain outcomes, and those outcomes are all totally defined. And it's basically dealing with issues like trying to deal with the reduction in diabetes programs, trying to deal with the reduction of those seen on a readmission, trying to do outreach programs in our school-based health centers or programs with the homeless and those populations. Really difficult populations. We have a great working relationship with THR, with Baylor, with HCA, and Methodist Mansfield. David and his team and others have worked very well with those, but also I want to compliment Public Health. They have been at the table with us. They have begun to really address the issues that we need to look at from a public health standpoint. And also to the team at MHMR, you all need to be really proud of your MHMR. They have set an example for the other MHMRs, not only in this region, but the state, because I think our MHMR here has been more aggressive than any other MHMR at looking at projects and programs to help that really difficult population. I don't want to go that way. I do want to go this way. This is a basic definition of the DSRIP. It really is a program designed to provide incentive payments. And again, this is not a block grant. This is not everybody line up and see how much money we can get. These are programs that are clearly defined to create better health outcomes and then fund those projects. And you got to understand that the federal government is looking at ways to cut costs. They're not looking to spend more money, but they are looking to direct it in the right way. And that's what I think the waiver does. As I mentioned, the counties that we have in our area, but we also have 21 performing providers. That's 15 hospitals, primarily through the Baylor system and the THR system, and then, as I mentioned, Methodist and in Mansfield, 4 MHMRs throughout the 9-county region. Your Academic Science Center, which is our friends at the University of North Texas, their Health Science Center, and Public Health. And Public Health, really, for this region is just Tarrant County. They look at major areas of community need, and they boiled it down to these. They look at capacity, which is basically increasing the capacity for providers to provide to specialty markets, such as the long-term diabetes patient. You look at access, trying to get into areas by which we create in Region 10 a better way to get a total continuum of health care. That speaks, Judge, to your question, and I know Commissioner Brooks's questions in the past about the electronic medical record and how do you make that seamless, and how does somebody who enters into the Stephenville Hospital at THR in Erath County become seamless when they become a trauma patient at JPS. And that's part of what you're dealing with access. The delivery transformation, creating evidence-based practices, and that is not just telling people what you do right, but the evidence behind it that shows the better way to focus on health care and the better way to integrate that. And then population health, the commitment to looking at better ways to create health through educational programs, through better eating, through better diets, those type things, geared specifically to a certain population that has a higher propensity to some type of illness. Hispanic culture is going to have a higher propensity to certain illnesses and diseases. African American, whatever the case may be, that's what that looks at. Look closely at, we just want to break down each one of those areas for you briefly, and this will not be a long presentation, Commissioner Johnson. But I'll go through this process and let you know that, like in the area of primary care services, what we want to do is we want to look at better ways. If you look at the Affordable Health Care Act, one of the things that's overwhelming, and the question I get asked more than any other single question in the community, is what is the Affordable Health Care Act going to do? And the one thing that I say is it's going to put a far greater emphasis on primary care, and that is a good thing. It is a good thing because if people of all walks of life continue to use an emergency room as their source of medical care, we all as taxpayers will always pay more. So the emphasis for the community need aspect is what JPS, one of our projects, is to look at expanding primary care services, expanding it out in the community, looking at how to integrate. As I mentioned to y'all before, JPS is in a great position with its clinics, but we don't integrate well to the main hospital. We have to figure out a better way to integrate. Geriatric services is another one that UNT Health Science Center has a plan for increasing geriatric care services. We at JPS are looking at expanding geriatric care. If you look at where our population is growing, as well as many others in the nation, it's our geriatric population. Providing better care for that population and dealing with issues such as falls, Alzheimer's, those type diseases that we all know that are out there, and trying to combat them better is what we're going to try to do. A little bit more in community need, looking at telemedicine so that the actual patient doesn't have to be in a specific room, but you're able to telecast that through electronic capabilities. We have a lot in this. We have North Hills, we have Plaza Medical Center, MHMR, our Medical Center of Arlington, are all looking at new telemedicine programs that will be allowing for a patient to be in one place and a series of doctors in another location to help out with that, or even providing educational information so that you don't have to move people, you move information. And I'll just go through a couple of these. Going a little bit more, integrating mental health care into primary care. One of the things that we see, and we even witness this in our school-based programs, is by the time the child gets to us in a school-based program, their manifestation of their problem, whether it's bulimia or anorexia or other issues, oftentimes are behavioral issues. If we could attack that upstream rather than downstream when we actually see the patient that is bulimic or anorexic, if we could deal with their behavioral issues up front, we might be able to be of significant benefit. Those what those talk about. Reduction of emergency department services, again, going back to primary care. The implementation of West Nile surveillance programs, obviously a very topical issue that our public health department has looked at. All of these are really highlighting what the public health department is looking at, greater education for healthier lifestyles. You can't ever stop talking about certain issues that one needs to help create healthier lives for people, particularly for our young generations. When you start some of these bad habits, eating, smoking, they stay with you sometimes longer in your life than we want them to. But I'm proud of public health. They've really put some good programs together for us. Pertussis is particularly one that's critical. Judge, I know you know that from young 3-year-olds that are around the house. The pertussis issue and whooping cough is oftentimes a problem of grandparents having it and babysitting those little ones, and then we pass it on. So proud of public health and what they're doing. Wanted to give you an idea just of a timeline. This will not really affect you all, but we wanted to put a timeline in here, in that we'll have the final selection on October 25th. We've been working really well with all of our partners, those 15 that I included earlier. Everybody stepped up to the plate to give us their projects. We will then submit those for a preliminary review to the state on October 31st. We will go through that process. The state will see them. David and his team have already talked to the state a lot about that. Then we have a webinar. That webinar is designed to get public comment. Instead of making everybody come to JPS and have a comment about it, we'll publicize the webinar aspect of it. Then that plan from the state will be submitted to CMS, and then we'll do what they call a pass-to. For those of all that projects that failed or money that was not provided, we'll have another opportunity to look at those dollars and put them into other projects that have been approved. So that really is some information for y'all. I know DSRIP is not the most exciting. It's not something that you're obviously waiting for the video to come out or the movie to be made, but we thought we would at least give you all an update. We will meet individually with any of your staffs that would like it. I want to thank you from a standpoint of the commissioners for who you all are bringing to our board meetings. I know that Commissioner Jenny from your staff back in your office, and then Karen who attends the meetings. Now Kathy with your office, Commissioner Brooks, Commissioner Fickus certainly with Carolyn, and then Alice in your office have been huge helps to us, and Steve as well, that come to our meetings and get the insight on this. But we'll do individual briefings when and how you see fit. And certainly Tom from your office, we're greatly appreciative of that communication that we have.
Any questions?
I have one question. The incentive revenue payments that you were talking about, is it new revenue, or is that just old revenue being redistributed?
It's a redistribution of those funds primarily. It's not new dollars.
It's not new dollars, okay.
And the way they're going to save money to potentially have more money to put in additional projects is those projects that don't reach their outcomes won't be funded. So that will allow for either projects that do have outcomes to be enhanced, or the money will be redistributed to other states and other places. That's how the feds are going to look at ultimately saving money on this. Projects that work will be funded. Projects that have been unsuccessful, that don't work, that don't have outcomes, will not be funded.
So Region 10 will have to come up with our own projects.
Which is what those are. Those are our projects for Region 10. Region 2, Region 3, Region 4, they'll have their own projects. What will be interesting is once you go through that first pass and Region 2 realizes they don't have a lot, shouldn't pick on Region 2, I don't even know where they are, but Region 2, for example, say they didn't hit a lot of they didn't get accepted in their programs, they'll have another chance at that, but then if they don't reach their outcomes, that money will be redistributed throughout the state. If the state fails, it will be redistributed to other states. So our goal in Region 10 is to be an example that people will want to emulate.
Thank you.
And again, I didn't mean to prolong that presentation, but I did want to give you an idea of what DSRIP is and the impact to our community, because it'll transform healthcare. overall.
I want to congratulate you for conducting an aggressive and inclusive process. There have been hundreds of agencies and various other providers of services who have been involved in this process. It's been transparent for the most part. And I think that you've done well.
Thank you. Thank you very much. We really have a good region, and we've got good folks, and we've been proud at JPS to do it. And I think we've shown the state that public hospitals can play a keen role in this, because we tend to be, in most of these cases, Switzerland and just trying to put better health care together for particularly charity care.
What you have done, though, is to raise the level of expectation in the community that all of these things are going to suddenly happen, and it ain't necessarily so.
Yeah, we've definitely told people this is not a block of money that you need to run to a line and go get it. This is, if you perform and you have the outcomes, you will be paid for it. If you don't, it's a new ball game. Thank you, Commissioner.
I'm getting good responses from my counterparts in our region, and then I'm also getting kind of questions from my counterparts outside of our region about, golly, y'all seem to be ahead on this deal.
Well, again,
I think we've been aggressive, and I appreciate your support of this and all that you've done toward making this happen.
Great. Thank you very much. I appreciate your comments.
Thank you, Robert.
Thank you, Commissioner. Thank you all very much. Thank you, Mr. Manning.
Thank you, Robert. Members Carter, we go to item B. This is a discussion concerning the direct court. It's the direct adult drug court program and its modifications. Mr. Shugart is here to address the court at this time.
Judge Whitley, Commissioners, I appreciate the opportunity to brief you on the changes the criminal judges have made to are proposing and are in the process of making to our drug court. As you know, a drug court is basically a therapeutic model with a criminal justice beginning and a criminal justice end. Our current program serves about 170 people to provide treatment and provide a mechanism for them to no longer be part of the criminal justice system, and so they don't show back up. The model is based off of Dr. Doug Marlowe. We had a study done in 2011 that pointed out that we need to focus on high risk, high need people, low risk, low need, and the timers are going. So we'll go back. The American University model showed us that we need to focus on high-risk, high-need people. Currently, the drug court model right now kind of does a mixed use between high-risk and high-need and low-risk and low-need. And so the study in court encourages us to look at two issues. Now, wrong direction, my bad. Create two issues. The requirement of smaller court size for better judicial interaction between the high-risk, high-need clients, and also because our program does address self-correctors as a public policy issue, we need to make sure there was a home for people that have an ability that they can self-correct and a mechanism so this drug charge wouldn't appear on their record. So the first step was to address the high-risk, high-need. What the judges are proposing to do is to create two drug courts. One in the 213th that will serve approximately 50 participants with close judicial supervision and use the current existing staff to address that. Then a parallel drug court will be created in the 432nd and again will serve an additional 50 clients and again provide the much needed judicial interaction and use existing staff. So this existing staff will be part of the current CJD grant that we receive from the state that funds our existing drug court. The next step is to find a home for the self-correctors. And we created two tracks within that, is a low-risk, low-need misdemeanor track and a low-risk, low-need felony track. These self-correctors will serve about, in the misdemeanor track, will serve about 75 participants. They'll be drug tested, hair tested, attend drug evaluation classes, and it's a 90-day program. And at next Commissioners Court, we're going to ask for approval of a fee of $600 for such a course. And this is a new case manager that you approved during the budget out of Fund 23-2200, which is a drug court fee that was established in September 1st, 2007. So this new position isn't even funded out of general funds. It's actually funded by a fee collected to fund this position. The low-risk, low-need felony will be about 25 participants supervised by the 372nd Court. And again, it's about a 180-day program and just basically doubling up. The thought of the low-risk and low-need will be handled by the same new case manager. And the key to this program is, with our discussions with the District Attorney's Office, is that there needs to be an assessment of the people that participate in this program to ensure that they are actually self-correctors. National studies show that self-correctors will correct about 90% of the time if given the opportunity. And so we're creating a program for these people to have this no longer appear on the record. It's really that simple.
Would you back up to the previous slide, please, the one with the fees on it?
Oops. Jim, help me out here. Okay. The yellow panel?
Yeah, that one.
Yeah.
Step 2.
Step.
The question is this. Are we at risk by charging such high fees for the misdemeanors and the felony clients who are involved in these two programs of setting up a parallel justice system only for those who have money?
There is a concern with that. However, it's a good question. Under our current program that we have right now, we received a grant from MH through the feds. We actually have scholarship programs to allow to cover these costs of these fees. So we'll be able to address some of those issues at that time.
Is there a way to earn the cost of these fees by doing some sort of community service, for instance, or something that will allow them to have some skin in the game, yet still be able to pay these costs? I mean, a scholarship is just a giveaway.
I understand that, and I assume the objective of the scholarship is that you trade for skins in the game in some capacity. It's not just a gift. There will be the mechanism. We are concerned, the judges are concerned that it doesn't become an exclusive club and that it is available to everybody.
That's precisely my concern.
And our goal under our current grant system is to increase the demographics and the participatory in these programs, and it is hoped that by doing this, first of all, that the high-risk, high-need program will be more diverse because of the system, and also allowing this system to also create a system that will be able to cull the people out of the jail and through assessments to ensure that people that are eligible for this program have access to this program, regardless of finances.
So, Commissioner Brooks, if I understand your comment and question, what you're saying is that you would like Mr. Sugar to go back and suggest to the judges that as part of the process for those individuals who are getting the scholarship, that they make and ask the judges if they might even consider some community service time also for them to work the deal.
My concern is a mechanism to allow broad access to these programs that is not dependent upon the weight of one's pocketbook.
Right.
Scholarships are good, but scholarships that one earns are even better.
Well, I agree with that, but I guess one of the concerns that I have is if you've got somebody who's working a job, is in the program, and is also now, if we load on top of while they're in the program, do community service, I don't want to set these folks up for failure also. I mean, I think community service after the fact or something, if they're getting this scholarship, that may be a good response. But, you know, I'm assuming that most of these folks are out and therefore are at least attempting to work a job and to make a living.
Yes, sir. And this is this low risk, low need is considerably at less cost than the current, what it costs to participate in the current drug course at that level. The average misdemeanor client pays about $1,800, I believe, between $1,500 and $1,800. So this is that includes drug tests.
Over what period of time?
6 months. 6 months.
Richard, how is the money paid? Is it paid all up front?
The proposal on this front is paid up front, and inclusive in those fees will be the standard drug test, the hair test we do outsourced.
I think you're eliminating the opportunity for a lot of people to get in it.
But that's what the scholarships are for.
Well, but you're going to give everybody, I mean, how many scholarships are you going to get?
What level of dollars do you have available from the feds for the scholarships?
I'm not willing to answer that question off the top of my head.
10% or is it?
I'm
30?
She's willing to answer that question. Come on forward.
Cynthia, would you please come up front? And introduce yourself much better than I can.
Cynthia Velasquez, I'm the program manager for Direct. We currently have a grant with a combination with Tarrant County of MHMR that allows for 20 grants per year if there's a need. What we do is we address the fees at the beginning of the program and then give a payment plan for the clients. Clients are required to pay for the misdemeanor. Excuse me. It's a $1,000 flat fee for the program, $11 for UAs, $55 for hair tests. So, and what we do is make them attend budgeting classes, documentation of employment, and at the end of the program, if someone's not able to pay and we have the documentation, then the judge will waive the fees.
Okay, but now, okay, you just used the figure of 1,000, and we're talking here of 600 and 850.
Excuse me.
And you said you got to pay it all up front, and you said you got a payment schedule.
No, this was for the current program that I'm talking
Okay,
about.
but I'm not talking about that one. I'm talking about
Right.
this one.
For this particular one, there's a breakdown also. So the cost is $600 and $850, but everything is included in that cost. The drug testing would be $11, the hair testing would be $55, the education class would be $50. So basically what we did is one sum to include everything. What we do is give the clients and the defense attorneys, a breakdown of all the fees.
But it's all due up front.
At the current design, yes, but it is very clear to me that the Commissioners Court want us to go back to the judges and address this issue to ensure that we're being as exclusive as possible.
Absolutely.
I agree.
Any other comments or questions at this time? Thank y'all. Thank you.
Finally, members of the court, if we can go to item C, this is an update on the West Nile virus. Dr. Parker is here to address the court at this time.
Morning.
Good morning.
Good morning, Doctor.
Thank you for the opportunity to update the court again on the current West Nile virus outbreak situation. The total number of West Nile virus infection in this 2012 arboviral season is 271, 172 West Nile fever, and 99 West Nile neuroinvasive disease. Unfortunately, there have been 10 West Nile virus-associated deaths reported this season in Tarrant County. The 10th death reported yesterday was an elderly male in Arlington with a history of underlying medical conditions. He was known to us previously as a West Nile neuroinvasive disease case. Since the last briefing, court briefing on October 9th, 13 mosquito pools have been submitted to the Tarrant County Public Health Laboratory for testing. No positives were detected in these samples. On October 12th, though, Arlington reported a positive sample from an outside laboratory. Recently, it has been necessary to address and correct misinformation which suggested underreporting of West Nile neuroinvasive disease in Tarrant County. Estimates of projected disease based on a research formula were presented as a means to double-check actual human case reports. The estimated numbers were not based on actual or real case reports, as the Tarrant County data is based, and therefore it can't be used to dispute or confirm our actual real case information. The state health officials are in agreement with Tarrant County Public Health that the estimated reporters are not consistent with the actual real case reports, and that other supporting evidence also shows this. West Nile neuroinvasive disease, as we've talked before, isn't subtle in its presentation, and it wouldn't be easily overlooked by physicians or the rest of the medical community. The state data demonstrates that about 90% of persons with neuroinvasive disease required hospitalization, and approximately 40 of those required ICU care. So Tarrant County Public Health is confident that the physicians and medical community across Tarrant County were aware of the outbreak and conscientious in the identification, diagnosis, and management of patients and the appropriate reporting as required. Furthermore, the formula that was used inappropriately and led to these inaccurate and overestimated projections simply stated they used the wrong variable. And it was stated by the author of the paper from where the formula came that the variable used shouldn't have been used and was excluded from his own calculations. This was not taken into consideration, and there was a failure to adjust for the variable. And at the end result, it led to an overestimation of the West Nile virus infections in Tarrant County. But regardless, it's important to note that these are mere estimates. The adjusted estimates also performed by Tarrant County are estimates. Estimates can't be used in a vacuum to drive a public health response, but they can be used for planning purposes. And Tarrant County Public Health will continue to work collaboratively with the medical community and all of our other partners to identify and determine and characterize an outbreak so that the appropriate public health and community response can be implemented.
So again, I think what I'm gathering from what you said is, first off, the system that they used had some flaws in it, and they admitted that. But bottom line, this was a model that's used in basically planning for the future. It should not be applied to something that's in the past where we have actual results to look to.
Absolutely, you're correct.
So as I read the article, I thought, okay, wait a minute. A model is for something to plan for the future, not to go back and look at a past and say, when you've got actual numbers. So thank you very much for that. Any other
And
questions?
its misuse is even more egregious if you don't use the right numbers.
Exactly.
Or the right
Or
formula.
the right formula.
Yes, sir, we agree.
Thank you very much.
Thank you.
Your Honor, members of the court, I'd like to go back to the administrator's section, if you wouldn't mind. And I'm going to take you through two actions, simply because the court's already acted on this. And this is the administrator's section. It's item 7A3, which was the exception to the travel policy. The end result is I'd like to hold this for 1 week. So what I would like for you, what I would ask the court to do is to pass a motion to reconsider this particular item at this time.
Why?
There's some errors on the court communication that I need to correct. There was an error made in our office on this because on the agenda it says the 325th District Court. It's the 352nd District Court, so it's not properly agendized in order to take action.
Move to rescind.
Second.
A motion and a second to rescind. Please vote. Motion passes unanimously.
Your Honor, members of the court, we're going to hold that item for 1 week.
Okay. Is that it?
That's it at this time, Your Honor.
Mr. Phillips, we've got the contractor squared away on blocking Calhoun.
Yes, Judge.
If that continues to happen, then the contractor may want to come and visit the court in the next week or so.
Yes, Judge.
Thank you. We'll now recess our open session closed to discuss items exempted under sections 551.071, 072, 074, 076, 078, and 087 of the Texas Government Code. And any other ones that
And now Commissioner Brooks is asking you to attend as well.
And bring your big cheap tablet so we can put some circuit boards in it.
Having returned from our closed session and there being no business to conduct at this time, we are adjourned.
In honor of
Dario Lorenzetta.